You wake up on a wooden table. Someone's holding your arms down, not gently. 4 grown men, pressing their full weight into your shoulders and wrists. A man is standing over your leg. He's holding a knife. You're wide awake. No drug in your body. Nothing to numb what happens next. The surgeon looks at you. Not cruel, just in a hurry. He knows something you're about to find out the hard way. Speed is the only mercy he's got. In the next 60 seconds, he's going to cut through your skin, your muscle, your bone, and you'll feel every bit of it. That's not a horror movie scene. That was a normal Tuesday. For thousands of years, that's just what surgery was. So how did people survive it? Body and mind both. Anesthesia, the thing that lets you sleep through surgery and wake up when it's already done, is only about 180 years old. So for basically all of human history, if something inside you needed fixing, you felt it, all of it. People assume surgery was rare before anesthesia. It wasn't. Archaeologists have dug up skulls, over 7,000 years old, with clean, deliberate holes drilled into them. Ancient brain surgery. The bone had healed around the edges. These people didn't just survive the operation, they lived for years after. So the real question isn't whether surgery happened without anesthesia, it's how anyone lived through it. Because sudden, extreme pain doesn't just hurt, it can kill you outright. Your body goes into shock. Your heart can just stop. Surgeons weren't only fighting disease, they were fighting the nervous system itself, and they barely had any tools to do it. People tried everything. Egyptian doctors used opium. Chinese physicians mixed up something called mafizon, believed to include cannabis. Medieval surgeons in Europe soaked sponges in opium and mandrake root, then held them under a patient's nose before cutting. Some went a totally different route, cold. Somewhere around the 1500s and 1600s, surgeons noticed that packing a limb in snow before amputating dulled the pain just enough to matter. Battlefield surgeons loved that trick in winter, for the obvious reason. The ice was already right there. Others leaned on pressure instead. Clamp down hard enough on a nerve or an artery, and the area would go half numb before the blade ever touched skin. Just not reliable. There was no way to measure a safe dose of opium, and honestly, the cold and pressure tricks only ever took the edge off. Too little drug, and the patient felt everything anyway. Too much, and their breathing could stop for good, meaning the cure for pain might kill you faster than the surgery would have. So most surgeons just didn't risk it, which leaves one question sitting there, unanswered. If you can't kill the pain, how do you operate on someone who's wide awake and about to feel the worst moment of their life? If you can't remove pain, there's only one thing left to control: time. Surgeons back then weren't rated on gentleness, they were rated on speed. Faster cut, shorter suffering, less chance the body just gives out from shock. The name that comes up every time is Robert Liston, a 19th century Scottish surgeon who could take a leg off in under 30 seconds. He'd hold the knife in his teeth while he positioned the limb, freeing up both hands for that first cut. Every movement rehearsed, almost choreographed, because hesitating meant more pain, and more pain meant a bigger chance the shock killed the patient before he'd even finished. But moving that fast, with a blade, on someone screaming and thrashing under you, that's asking for disaster. There are stories, probably stretched a bit over the years, but rooted in something real, about Liston moving so fast he once sliced off an assistant's fingers mid-amputation. Exaggerated or not, it points at something true. Speed surgery was dangerous for everyone standing in that room, not just the guy on the table. Slow surgery risked killing through shock. Fast surgery risked killing through a slip of the hand. There was no safe option here, just 2 different flavors of danger to pick from, which brings up the obvious next question. If that's really what it looked like, why would anyone agree to it? Plenty of people didn't. They skipped surgery entirely, but plenty walked into it anyway, eyes wide open, because the alternative was usually worse. A gangrenous leg wasn't just painful, it was a death sentence. Just a slower one. A few unbearable minutes on the table could buy you decades more of life, so people found their own ways to get through it. Some got drunk beforehand, not because alcohol actually dulls surgical pain much, but because it dulled the fear leading up to it. Soldiers bit down on leather or wood, giving their bodies something to clench instead of just falling apart under the pain. That's probably where bite the bullet comes from. Surgeons picked up a skill you wouldn't expect: talking. The good ones learned how to keep a patient calm right up until that first cut, because a terrified body reacts to pain harder than a calm one does. Fear alone could decide whether someone made it through. So a surgeon's real skill was never just in his hands. Some of it lived in his voice. And that idea, that the mind itself might hold the key to blocking pain, actually led somewhere strange in the early 1800s. A Scottish doctor named James Esdale, working out in India, started experimenting with something people back then called mesmerism, a kind of hypnotic trance. He'd talk patients into a deep, glassy-eyed state before operating, and he claimed case after case of major surgery, tumor removals, even amputations, done while the patient stayed calm and barely flinched. Other doctors didn't buy it. Some accused his patients of just faking calm to please him, but for a strange few years, years, hypnosis was a genuinely serious contender in the race to beat pain, right up until something else came along and made the whole idea look almost quaint. Here's a detail that rarely gets told. The surgeon wasn't the only one whose skill decided if you lived or died. The people holding you down mattered just as much. Hospitals leaned on strong assistants, often ex-soldiers, whose entire job was pinning a patient with exactly the right amount of force. Too little, and a thrashing patient could knock the blade off course. Too much, and you could dislocate someone's shoulder while they're already in agony. Every single day, these men showed up to hold another human being through the worst moment of their life. Knowing their grip was the difference between someone surviving or not. History barely remembers them, but they mattered just as much as the blade did. Surviving the surgery wasn't the end of it, either. No anesthesia, no antiseptics, so recovery meant fighting off infection, blood loss, shock, usually with nothing but herbs, prayer, and time. And there's a whole layer of this we barely get to hear about. Most of what survives on paper comes from surgeons. Clinical notes, technique, outcomes, not from patients talking about what it actually felt like afterward. Millions of people went through some of the worst trauma a human body can survive and were left with almost nothing in their own words about what came next. That silence tells you something on its own. For thousands of years, pain during surgery wasn't a problem to solve. It was just part of life, like weather, like death. Then, in the 1840s, everything flipped, and not in a hospital. At parties, nitrous oxide and ether had become party favorites. Laughing gas parties, people called them, where folks inhaled the stuff just to feel giddy and weirdly detached from pain. And people at these parties kept noticing something odd. Someone stumbles, gets hurt, and barely reacts. For years, that was it. Just a party trick, nothing more. Then, in 1846, a Boston dentist named William Morton asked a question nobody had really taken seriously before. What if this fun gas could actually block surgical pain? He gave ether to a patient before removing a tumor from the man's neck in front of a crowd, in a room now remembered as the ether dome. The patient didn't scream, didn't need to be held down. He just slept through it. Word got out fast. Within a few years, the idea of a fully conscious amputation went from completely normal to almost unthinkable. Surgeons who'd spent entire careers training to move as fast as humanly possible suddenly didn't need that skill anymore. Some of them, weirdly, mourned it a little. Speed had been their whole identity as a surgeon, and now it barely mattered. Before anesthesia, how long a surgery lasted came down to one thing: how much pain a conscious body could take before shock killed it. That was the ceiling, not skill, not knowledge, just raw human tolerance. Once pain stopped being the limit, medicine took off. Long, careful operations on the heart, the brain, internal organs, suddenly possible because surgeons weren't racing a clock anymore. And here's the part that stops people cold. All of it. Heart surgery, transplants, brain surgery, traces back to a party trick. People getting silly off gas for fun. And one dentist wondering if that same buzz could save a life instead. The biggest breakthrough in the history of surgery didn't start in a hospital. It started at the edge of something that looked like nothing more than a good time. At first, somewhere between a screaming operating table and a silent, sleeping patient, an entire era of human suffering just quietly ended. And most of us never spare a thought for the people who lived through what came before it. Next time you go under anesthesia, remember what that moment used to cost. The men gripping a stranger's shoulders with everything they had. The surgeon racing his own patient's pain, knife between his teeth. The millions who went through something we can barely picture, simply because it was the only option on the table. You'll never know that particular kind of fear. And honestly, that might be one of the quietest miracles of modern life.